Medicare Part D, prescription drug plans. These are what cover you for all the drugs that you get outside of the doctor's office. Scroll down and you'll see a little table, and we're going to look at this and see how these plans work. And by the way, it works the same as a standalone drug plan or an Advantage plan. This is the outline that Medicare mandates that all prescription drug plans follow. So if you look down there, you'll see a deductible range. Some plans have deductibles, some don't. And some can range between the zero and the limit you see there. The deductible is where you're paying the full price of the drug up until that deductible is met. Once it is met, you'll pay a copay or a coinsurance, which is a percentage of the full drug cost. So let's give an example of this. Let's say you have two drugs, a generic drug, full retail cost of $20, and a brand name drug, full retail cost of $270. You have a copay for these two drugs. The generic drug is $3. The brand name drug is $47. So when you go to the pharmacy each month, you'll pay $50 for your two drugs. But the total cost is what the insurance company is going to add up every month, and that's the $20 plus the $270, $290 a month. That amount is being added toward that stage's upper limit, which you'll see on the left-hand side. If you meet the limit, and most people do not, but if that limit is met, then you go into the coverage gap. The coverage gap is, or donut hole, as it was called, was when the plans originally came out, there was no coverage here. But now there is, and you'll be paying, starting in 2019, 25% of the total cost of your drugs is what you'll be paying. So, you'll notice another number on the upper right there. That number is met if we take the total cost of the drugs in the gap added to the $50 a month that you paid down below in the initial stage and in the deductible stage. If those totals reach that upper limit on your right, then you go into catastrophic coverage, where you'll pay a small copay or a small coinsurance amount, whichever is greater, for the remainder of the year. Now, I realize that's a bit complicated, and I've often wondered why they've made it that way, but that's what we have. And so if you have questions on how your drugs would work within that framework, go to Medicare.gov or give me a call and I'll help you through it. Now, just as Part B had a charge based on income, so does the prescription drug plans. If you scroll down there, you'll notice a similar chart to what we saw with the Part B premium. If you're a higher income individual, they will tack on an additional amount for your Part D plan. And this changes a bit every year, but you need to be aware if you're paying a higher Part B premium, you're also going to be paying a higher premium for your prescription drug plans. So, how do we select a plan? First things first, you want to make sure that all your drugs are on the plan's formulary. And the formulary is simply a list of drugs that the plans cover. Make sure that they're on the formulary. The other thing is to see how that plan tiers your drug. Now, tier is simply a pricing structure. The lower the tier, the lower the price. So you want to compare plans. If they're on the formulary, great. How do they tier them? Because I've seen some drugs might be a tier 1 on one plan, and it might be a tier 3 or a tier 4 on another plan. So you want to make sure that your drugs are tiered as low as possible, because that's going to keep your costs down. Another thing to be aware of is step therapy. If you have step therapy placed on a drug, and that's simply what the plan is saying, they want you to go to a lower price drug. They're going to let you make an initial purchase of your current drug, but they're going to ask that you move to a lower price drug. Avoid step therapy. If the plan that you're looking at has it, be aware that if you're going to go with that plan, you're going to have to move off your current drug. If you don't want to do that, find a plan that doesn't require it. Quantity limits is another thing. Some drugs that are going to limit how much you can buy at one time. Mail order is another opportunity to save price. The price of a drug in mail order, particularly for generics, can be very low. I've seen some plans that will ship Tier 1 generics and sometimes Tier 2 generics to you at no cost. So there's money to be saved there if you qualify for it. The other big thing is your pharmacy on their preferred pharmacy network? It does make a difference if you go to a preferred pharmacy versus a standard pharmacy on many of these plans. So check that out. Finally, I want to make you aware of the Part D, late enrollment penalty. If you do not have qualified drug coverage, Medicare is going to fine you 1% per month for every month you could have had coverage but did not. So let's say, for example, you enrolled in Medicare in July, but you're not taking any drugs. So you didn't sign up for Part D, and you didn't sign up for Part D at the end of the year, so you're going into through your second year. And during that second year, you're prescribed a couple of drugs, and you think, okay, this is a good time to get a drug plan. Medicare is going to add up the number of months you could have had coverage but did not. So July to the end of the year, that's 6 months. We add it to the 12 months of the following year, that's 18 months. Medicare is going to assess an 18% penalty on your drug plan premium, and that's a lifetime premium. And that's calculated. You'll see how that's calculated there on the page, and I won't get into that. You can read it yourself. Be aware of that. And so when people come to me and say, hey, I'm not taking any drugs, why should I get a plan? Well, if you're going to avoid the penalty, I just suggest find the lowest priced drug plan in the market and purchase it. Because once you make the decision not to purchase, it could be rather expensive down the road if you decide to sign up. If you have questions when it comes to prescription coverage, Part D plans, call me or shoot me an email. Be happy to walk through this with you, and we'll see if we can find a plan that makes sense for you. Again, look forward to seeing you in the next video. Thanks for watching if this is the last one you're going to see, but I encourage you to look at the long-term care video as well. That's coverage I think we all need to consider. Thanks.